Neo-Polycin ointment is used to treat bacterial eye infections. It contains neomycin, bacitracin, and polymyxin, which are antibiotics that stop the growth of bacteria. It's important to note that this ointment will not work for other types of eye infections, like those caused by viruses or fungi. Using antibiotics unnecessarily or incorrectly can make them less effective. The recommended dosage and the best time to apply the ointment will depend on your doctor's advice, so be sure to follow their instructions carefully. When using Neo-Polycin ointment, it's important to follow your doctor's instructions. The dosage is based on your medical condition and response to treatment. Before applying the eye ointment, wash your hands thoroughly. Avoid wearing contact lenses while using this medicine, and if you do wear contacts, make sure to sterilize them according to the manufacturer's directions. To apply the ointment, tilt your head back, look upward, and pull down the lower eyelid to create a small pouch. Squeeze a 1/2 inch strip of ointment into the pouch and then close your eye, rolling the eyeball in all directions to spread the medication. Try not to blink or rub your eye. If you are using other eye medications, make sure to wait at least 5 minutes before applying Neo-Polycin ointment. Use the medication regularly at the same time each day for the most benefit. Even if your symptoms improve, continue using the medication for the full time prescribed. If your condition does not improve or if you develop new or worsening eye symptoms, contact your doctor right away. When using Neo-Polycin ointment, you may experience a stinging or burning sensation in your eyes for 1 to 2 minutes, or temporary blurred vision. If these effects persist or worsen, it's important to consult your doctor or pharmacist. It's essential to remember that this medication has been prescribed to you because your doctor believes that the benefits outweigh the potential side effects. Many people who use this medication do not experience any serious side effects. While it's rare, it's important to seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as a rash, itching or swelling of the face, tongue, throat, eye, or eyelid, severe dizziness, or difficulty breathing. It's important to note that this is not an exhaustive list of potential side effects. If you notice any other effects not mentioned here, it's important to reach out to your doctor or pharmacist. If you're in the US, you can call your doctor for medical advice about side effects, or report them to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report them to Health Canada at 1-866-234-2345. Before using Neo-Polycin ointment, make sure to inform your doctor or pharmacist if you have any allergies to neomycin, bacitracin, polymyxin, aminoglycoside antibiotics, or any other allergies. This medication may contain inactive ingredients that can cause allergic reactions, so it's important to discuss this with your pharmacist. Also, be sure to inform your doctor or pharmacist about your medical history, especially if you have other eye problems. After applying this ointment, your vision may become temporarily blurred, so avoid driving or using machinery until your vision clears up. If you are pregnant, only use this medication if it is clearly needed, and discuss the risks and benefits with your doctor. It is not known if this drug passes into breast milk, so consult your doctor before breastfeeding. As for the usage of Neo-Polycin ointment, follow the instructions given by your doctor or pharmacist. Apply a small amount to the affected area, usually 1 to 3 times a day. For the best results, use it at the same times each day. When using Neo-Polycin ointment, it's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. Always consult with your healthcare provider before making any changes to your medication routine. If this ointment is ingested, it can be dangerous. If someone has taken too much and is experiencing severe symptoms such as losing consciousness or difficulty breathing, it's important to seek immediate medical attention by calling 911. Otherwise, contact a poison control center in your area. In the US, you can call 1-800-222-1222, and in Canada, reach out to a provincial poison control center. It's important to remember not to share this medication with others, as it has been specifically prescribed for your current condition. Once your treatment is completed, make sure to dispose of any unused medication. And unless your doctor instructs you otherwise, do not use it later for another infection. If you forget to use Neo-Polycin ointment at the scheduled time, apply it as soon as you remember. However, if it's close to the time for your next dose, just wait and use it then. Do not use extra ointment to make up for the missed dose. Just continue with your regular dosing schedule. Make sure to store Neo-Polycin ointment at room temperature and keep it out of reach of children and pets. Do not dispose of the ointment by flushing it down the toilet or pouring it into a drain unless specifically instructed to do so. When the product is expired or no longer needed, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.